Good day, I'm Pearl Angelis Sabal from BSN 1B, and for today I will be doing the assessment of the eyes. To begin with, first we will need to prepare all the materials and equipments needed. After doing that, we will introduce ourselves to the patient and verify the patient's identity. Sir, good morning. I'm Pearl Angelis Sabal. May I know your name?
My name is King Christian M. Sabal.
Okay, sir. May I check your wristband for a while? Okay, sir, thank you. And after that, discuss the procedure you will be doing to the patient and why is it necessary and how the patient can cooperate with you during the procedure. Okay, sir, for today po, i-assess ko po yung eyes ninyo para po makita ko kung may any abnormalities po na present or underlying problems po. Is it okay with you, sir?
Opo. Yes.
Okay, sir. All you need to do is to follow my instructions during the procedure para po mapabilis yung assessment natin. Is that okay with you, sir?
Yes po.
Okay, sir. Thank you. After that, perform hand hygiene and observe any other infection control procedure. In my case, I already performed hand hygiene beforehand, and I also put a gloves or an examination gloves. And then after that, provide privacy to the patient or the client. Make sure that the curtains are closed or the door is closed. After that, ask necessary questions to the patients regarding his health history. Okay, sir, meron po ba kayong family history ng diabetes?
Wala po.
Ng hypertension po?
Wala po.
Sakit po sa dugo, sir? Meron po?
Wala po.
Any eye problem po, sir?
Wala po.
Kaya nag-undergo na po ba kayo ng eye surgery?
Hindi po.
Okay, sir. Kailan po yung huling check-up niyo sa mata?
As year po.
Okay, sir. Meron po ba kayong mga medications na iniinom?
Wala po.
Nagsusuot po kayo ng salamin?
Hindi po.
Okay, sir. Meron po ba kayong nararamdamang pananalabo o pananakit ng mata?
Wala.
Okay. After doing that, we will now proceed to the assessment of the external eye structures. First, we will need to inspect the eyebrows for the hair distribution and alignment, and the skin quality and movement. Okay, sir, mag-start na po ako. Okay. Sir, can you move your eyebrows po? Hold it po, sir. Okay, sir. Thank you. And then after that, inspect for eyelashes for the evenness of the distribution of the hair and the directions of the curl. Okay, sir. Thank you. And then inspect for the eyelids of the eyelids for the surface characteristics, position in relation to the cornea, ability to blink, and the frequency of the blinking. Lower lids are inspected while the patient's eyes are completely closed. Okay, sir. Assess ko na po yung eyelids ninyo. Okay, sir. Now, sir, paki-close po yung eyes ninyo. Okay, sir, thank you. And then, inspect for the bulbar conjunctiva for the color, texture, and presence of any lesions. Okay, sir. Diretso lang po yung tingin. After that, inspect for the palpebral conjunctiva by everting the lid. If any problems are suspected, evert the upper lids and then ask the patient to look down while the eyelids are slightly open, and then gently grasp the eyelashes using your thumb and forefingers, and then pull it gently downwards. Sir? Open lang po yung eyes mo muna. After doing that, doing those procedure, place a cotton tape applicator stick above the inverted lid or eyelash, and then continue to hold the eyelashes, and then hold the margins of the inverted lid or the eyelash against the ridge of the upper bony orbit with a applicator or cotton tape applicator or thumb. Then inspect for the conjunctivus, color, texture, any presence of lesions and foreign body. Certainly. Look down po kayo. Ganyan. Look down po, sir. After doing that, we will now proceed to the inspection and palpation of the lacrimal gland. Inspect and palpate the lacrimal gland using the tip of the index finger and observe for any edema between the lower lid and the nose. Sir? After that, we will also inspect for and palpate for the lacrimal sac and the nasal lacrimal tract. Observe for any increase in tearing when you do this procedure, and use the tip of your index finger and then palpate the lower orbital rim near the inner canthus. And after doing that, we will now observe and inspect the cornea for the clarity and texture. First, we need to ask the patient to look straight ahead and open both eyes. Sir, look lang po kayo ng diretso, and then open nyo po yung eyes nyo ng fully. Okay, and then hold the pen light. Hold the pen light at an oblique angle of the eye, and then move the light slowly across the corneal surface. Okay, sir, diretso lang po yung tingin. And then after that, perform the corneal sensitivity or the reflex test to determine the function of the fifth cranial nerve or the trigeminal nerve. Ask first the patient to look straight ahead again and open both eyes. Diretso po ulit ang tingin, sir, and open niyo po yung both eyes ninyo. And then approach the patient from behind and beside, and then lightly touch the cornea using the corner of the gauze. Okay, sir, diretso lang po yung tingin. And then, after doing that, we will now proceed to the inspection of the pupil's color, shape, and symmetry of size. And then we will observe for the pupil's response to direct and consensual light. Okay, first we need to ask the patient to look straight ahead. Okay, sir, look straight ahead po ulit. Diretso po ang tingin, okay? And then, open niyo po yung eyes ninyo. And then, we will partially darken the room. And then after that, using a pen light from the side of the eye of the patient, approaching from the side of the eye of the patient, shine the light on the pupils and observe if the pupils that is being shined on is constricting or constricts. And this is the direct response. Okay, sir. After that, shine the pen light again on the pupil and observe if the other pupil responds or constricts, and this is the consensual response. And then after doing that, assess the pupils or inspect the pupil's response to accommodation. Ask the patient to look straight ahead again, and then from the nose of the object 10 centimeter at distance, hold an object, and then ask the patient to look at the top of the object you are holding first, and then after that to the object behind the object you are holding. Alternate the gaze between the near and far object, and the pupil should constrict when the patient is looking at the near object, and it should dilate when the patient is looking at the far object. Okay, sir, paki-adjust lang po natin yung paan natin. Adjust mo yung paan mo, sir. Hindi yung height. Okay. And then, sir, tingin po muna po kayo sa top ng object. Tingin po kayo. And then, after nun, tingin po kayo dun sa, mag-focus naman po kayo doon sa object na malayo. Okay? Naintindihan niyo po, sir? Okay. Sir, tingin po kayo sa object. Dun sa malayo. Sa malapit. Sa malayo. Sa malapit. Sa malayo. Okay, sir. Thank you. And then after that, to test for the convergement of the pupil, while holding the object, move the object towards the nose of the patient and see if the pupils converge. To assess the normal or to have the normal assessment of the pupils, refer to the acronym PERLA, which is pupils equally round and reflective or reactive to light. Again, pupils equally round and reactive to light and accommodation. Okay, sir, tingin po kayo dito. Now, we are done assessing the external eye structures, and we will now proceed to the visual fields of the vision. After assessing the external eye structure, we will be now assessing the periphery fields of vision. Assess for the periphery fields of vision and have the patient sit in front of you, directly facing you at a distance of 60 to 90 centimeter, and ask the patient to cover his right eye and look directly at your nose. For the nurse who are assessing, close the eye or cover the eye directly opposite to the client's covered eyes, and then also look straight or directly into the client's nose. Hold an object and then extend and move your arm into the visual field from the various points of periphery, and then ask the client when the object first spotted, or when the moving object is first spotted. Make sure that the distance between the object and the patient and yourself is equal, and then do the assessment. To test the temporal field of the left eye, extend and move your arm in from the right or from the client's right periphery to test the upward field of the left eye. Extend and move your arm down from the upper periphery and to test the downward field of the left eye. Extend and move your arm up from the lower periphery and to test the nasal field of the left eye. Extend and move your left arm in from the periphery. Now we will do the assessment. Also, don't forget to do or repeat the procedures for the right eye. Okay, sir. Close your eye, cover your eyes po, your left eye. or your right eye po pala. Okay, and huwag niyo pong lagyan ng pressure. And then, look directly at my nose po. Just pakiayos lang po. Then, look at my nose po directly. Wala po ba kayo nakikita ang pandalabo sa mukha ko?
Wala po.
Okay, sir. And then, pag pumilog ko po yung object, pakisabi po yung yes kapag po nakita niyo na po yung object, okay? Immediately po yung yes, okay, sir?
Opo.
Okay. I will now begin, sir.
Yes. 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 Yes.
Okay. Now, yung kabilang eye naman po, yung i-cover natin.
Yes. 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 Yes.
Okay. Now, we are done for assessing the periphery vision or the visual fields of the patient. After assessing the visual fields of the patient, we will now assess for the extraocular movements of the eye to determine eye coordination and alignment. First, stand directly in front of the patient and hold an object at a comfortable distance such as 30 cm in front of the eyes of the client. And then ask the patient to hold his head in a position or in a fixed position and look directly in front of you. And then follow the object you will be holding using his eyes only. And then move the pen light you are holding or the object you are holding in a slowly ordered manner so that the patient can gradually follow it, and then move it towards the six cardinal fields of gaze. When doing this assessment, stop the movement of the object or the pen light periodically to determine the location or to determine the nystagmus. Okay, sir, tingin lang po ng diretso sa akin and po, straight lang po yung head and wag niyo pong gagalawin and i-follow niyo po yung object na ito using your eyes only, sir. Is that okay?
Yes.
Okay, sir, I will now begin. Okay. Now, assess for the light reflex or the location of the light reflex by shining the pen light on the pupil in the corneal surface. This is called the Hirschberg test. Okay, sir, diretso lang po natingin. Okay, sir, thank you. And then, for the last assessment of the extraocular movements of the eye, have the patient fixate on a near or far object and then cover the one eye of the patient and then observe for the movement for the uncovered eye of the patient. This is called the cover test. Okay, sir, diretso lang po ang tingin sa isang object. Mag-focus po kayo sa isang object. Okay, like this po. And then, iko-cover ko po yung eye nila. Okay, diretso lang po, okay, sir? Okay. Okay, sir. Thank you. Now we are done for assessing the extraocular movements. Now we will proceed to the assessment of the visual acuity. Now, to assess the visual acuity, first, to assess for the near vision, ask the patient by providing or allowing adequate lighting, and then asking the patient to read from a newspaper or magazine. Okay, sir? Paki-read niyo po yung ilang. Paki-read po ito.
Giardia lambiae is an intestinal protozoan that was initially known as Sermonans intestinalis at present.
Okay, sir. Thank you po. And then, assess for the distant vision by asking the patient to wear corrective lenses unless they are only used for reading. And then ask the patient to stand or sit 6 meters away from the Snellen eye chart. And then ask the patient to cover the eye not being tested. And then identify the shapes or the characters in the chart. Take 3 readings for the right eye, the left eye, and the both eye. Okay, sir? Stand po kayo dito. And then, cover niyo po yung right eye ninyo, sir. And then, read po yung nasa Snellen chart. Okay. Go.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, O, D, P, G, T.
Okay, sir. Now po yung kabilang eye naman po, paki-cover.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, O, D, P, O, P, O, T.
Okay, now po yung both eye na po ninyo, wag na po i-cover po silang dalawa. Okay, start po.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, T, O, D, F, C, T.
Okay, sir. Thank you po. You can sit na po, sir. Now, if you're done assessing the external eye structures, the visual fields, the extraocular movements, and the visual acuity of the patient, documents the recordings that you find and note for the abnormal findings that you assessed, and then keep the patient record.